Have you ever grabbed a painkiller and thought, it's just over the counter, how bad could it be? Yeah, I used to do that too. The truth is that all drugs, whether prescription or over-the-counter, can have side effects. The kidneys work hard to filter waste and extra fluids from your blood 24/7, including the prescriptions you take. But some medications, especially when taken for a long time or in the wrong way, can damage the kidneys. This type of damage is called nephrotoxicity. In this video, we are counting down the top 10 prescriptions that can harm your kidneys. We'll rank them from most to least harmful based on their risk of causing kidney damage. The good news, this knowledge goes a long way. Stick around, your kidneys will thank you later. Welcome to another episode of Nutri-Millionaire Health Channel, where we talk about your health because health is your real wealth. And hit subscribe so you don't miss health tips that could save your health now. At the top of the list of prescriptions with the potential to harm the kidneys are non-steroidal anti-inflammatory drugs, NSAIDs. Did you know more than 30 million people worldwide use NSAIDs daily? Medications like ibuprofen, naproxen, diclofenac, and celecoxib are widely available over the counter. They are commonly used to relieve pain, reduce fever, and treat cold symptoms. Their anti-inflammatory properties make them highly effective. A 2021 review titled "Kidney Damage from Non-Steroidal Anti-Inflammatory Drugs, Myth or Truth?" confirms that NSAIDs can harm the kidneys by narrowing their blood vessels. This reduces oxygen supply, which, over time, can lead to kidney damage. NSAIDs can also cause kidney harm in other ways by the damage it causes to the kidney's filtering system, making it harder for the kidneys to do their job properly. Over time, this damage can lead to kidney disease. NSAIDs can interfere with the hormones that help control potassium levels. Too much potassium in the blood can be dangerous, potentially causing irregular heartbeats or other serious health issues, while some NSAIDs can be toxic to kidney cells, leading to inflammation or even cell death due to lack of oxygen. These risks highlight why NSAIDs should be used with caution, especially for people with pre-existing kidney conditions or other risk factors. Always follow your doctor's instructions when taking it. Important notice. Kindly note that all information presented on this channel is based on thorough and relevant scientific research conducted by a medical professional. Do you question the safety of antibiotics? Then you are not far from the truth as we dive into the next point. 2. Aminoglycoside antibiotics are a group of antibiotics, including gentamicin and tobramycin, used to treat serious bacterial infections. They are commonly prescribed for infections in the urinary tract, lungs, and bloodstream. These antibiotics are highly effective, especially in life-threatening infections, because bacteria struggle to develop resistance to them. However, these antibiotics must be used carefully, as they can damage the kidneys. Notice how aminoglycosides can harm the kidneys. After being filtered by the kidneys, aminoglycosides can accumulate in the kidney's filtering tubules, especially if you are dehydrated. When too much builds up, it can enter these kidney cells. Once inside the kidney cells, aminoglycosides can trigger processes that cause cell death. This can lead to reduced kidney cell function over time. This medication can also clump together and form crystals in the kidneys, making it difficult to urinate properly. Research shows that gentamicin, a commonly used aminoglycoside, has been shown to reduce the kidney's ability to filter waste effectively, leading to a lower glomerular filtration rate, GFR, a key measure of kidney function. To minimize kidney damage, doctors carefully adjust the dosage based on factors such as the type of infection, age, height, weight, and kidney function. Blood tests are also done before and during treatment to monitor kidney health and ensure the drug is being used safely. Still on yet another class of antibiotics. 3. Vancomycin is a common antibiotic used to treat serious infections caused by bacteria that don't respond to most antibiotics. Proper dosing and monitoring are essential to make sure it works well and avoids harming the kidneys. This antibiotic has been used for over 65 years to fight infections like MRSA, methicillin-resistant Staphylococcus aureus, and other stubborn bacterial infections. However, it can sometimes cause kidney damage if not managed carefully. A 2023 study in a Brazilian hospital looked at how often patients developed kidney problems before and after introducing new guidelines for vancomycin use. Before the guidelines, nearly 38.4% of patients experienced kidney injury, After the guidelines were put in place, this dropped to around 20.9%. The results show that following clear protocols for dosing and monitoring vancomycin use can greatly reduce kidney risks. This study stresses the importance of checking kidney function regularly during treatment. Here is yet another class of drug that has been proven to harm the kidneys. 4. Proton pump inhibitors, PPIs, are medications commonly used to treat stomach issues like ulcers and acid reflux. While they help reduce stomach acid and ease symptoms like heartburn, long-term use has been linked to kidney problems. PPIs work by blocking acid-producing pumps in the stomach, lowering acid levels for up to a day. Since their FDA approval in 1989, they've become one of the most prescribed drugs in the US. Long-term use of proton pump inhibitors, PPIs, has been linked to acute interstitial nephritis, a type of kidney inflammation that damages the kidney's filtering ability. This can lead to sudden kidney injury. Studies show PPI users face a 20–50% higher risk of chronic kidney disease, CKD, compared to those using alternatives like other acid-reducing medication. Kidney injury from PPIs might start as temporary AKI, but could progress to CKD over time. PPIs can also lower magnesium levels, worsening kidney health and requiring additional treatment. By staying alert to these risks, healthcare providers can help patients manage stomach conditions safely while protecting kidney health. Go ahead and smash that like button if you think this video is enlightening. Next is a prescription that has the kidneys as its main target. 5. Diuretics help your body remove extra salt and fluid by affecting how your kidneys process sodium and water. For this reason, they are commonly called water pills. They're often used to treat conditions like high blood pressure, swelling from fluid buildup, and kidney problems. However, while they ease symptoms, they can also harm kidney function in some cases. How diuretics work? Your kidneys filter waste and fluid through tiny units called nephrons. Diuretics target parts of these nephrons to reduce sodium reabsorption, increasing urine output. This helps manage fluid overload but can also lower blood volume, which may strain the kidneys over time. Risks of diuretics to kidney health. Diuretics can drop blood pressure too much, reducing blood flow to the kidneys. In some cases, high doses or long-term use may slow the kidney's ability to filter waste. Other cases result in electrolyte imbalances seen in low potassium, causing heart rhythm issues, and low sodium or magnesium levels. In advanced kidney disease, higher doses may be needed, raising risks. In rare cases, after diuretic effects wear off, the body may hold on to sodium again, stressing the kidneys. Why monitoring matters? A recent Cochrane review highlights the need to balance diuretics' benefits with their risks. While they're crucial for managing kidney-related issues, regular checkups are key to track kidney function, adjust doses safely, prevent long-term damage. Antihypertensive drugs are not entirely kidney-friendly. Here is why. 6. Angiotensin-converting enzyme, ACE inhibitors, and angiotensin receptor blockers, ARBs, are prescription pills taken by mouth that help lower blood pressure while protecting your kidneys and heart. Though they belong to different drug classes, they work similarly and have been used since the 1980s in the US. How they help? ACE inhibitors and ARBs protect tiny kidney filters, glomeruli, and reduce protein in urine. They lower the risks of heart disease, heart attacks, or strokes by relaxing blood vessels to ease pressure on the kidneys and the body. Who benefits? A common myth is that these drugs only help people with high blood pressure. In reality, they're also useful for those with kidney disease or heart failure, even if blood pressure is normal. Possible risks to kidneys. While they rarely cause sudden kidney injury, risks rise when combined with painkillers and diuretics and when accompanied by not drinking enough fluids. If you need ACE inhibitors and ARBs for other health issues, talk to your doctor about balancing risks and monitoring kidney health. Side effects of ACE inhibitors and ARBs on kidney function. Lowers how well your kidneys filter waste, often due to changes in blood flow. A temporary rise in creatinine, a waste marker, is common when starting treatment. It can cause dangerous potassium buildup, especially in people with pre-existing kidney conditions. Let's turn our attention to drug use in diagnostic imaging next. 7. Contrast dyes, also called radiocontrast media, are substances used during imaging tests like CT scans, MRIs, or angiograms to improve image clarity. They're either swallowed or injected. While these dyes help diagnose and treat diseases, they can pose risks to kidney health. Types and risks. Iodine-based dyes used in CT scans may cause contrast-induced nephropathy, CIN, a temporary drop in kidney function due to reduced blood flow to the kidneys. Gadolinium-based dyes used in MRIs, rarely linked to nephrogenic systemic fibrosis, NSF, a condition causing skin thickening or darkening in people with severe kidney disease. Most patients have no issues, but risks rise for those with diabetes, heart or blood vessel issues, and chronic kidney disease, CKD. Symptoms of contrast-induced nephropathy, CIN, include fatigue, poor appetite, swollen ankles, puffy eyes, or itchy skin, similar to kidney disease symptoms. Even though this condition is often reversible, severe cases can lead to lasting kidney damage or heart issues. Does the widespread use of chemotherapy in cancer treatment mean that they are safe for the kidneys? 8. Chemotherapy. Drugs save lives by fighting cancer cells, but some can also damage your kidneys. Examples of kidney-harming chemo drugs and how they damage the kidneys. Cisplatin damages kidney tubules or tiny filters, leading to sudden kidney injury. It can also cause long-term issues like kidney scarring. Methotrexate can form crystals in the kidneys, blocking urine flow and causing injury. Crizotinib is linked to fluid-filled cysts in the kidneys, which may shrink after stopping the drug. Ipilimumab triggers kidney inflammation, but this often improves with steroid treatment, while ifosfamide causes bladder and kidney irritation, leading to blood in urine and swelling. Here is how such kidney damage becomes evident. A quick drop in kidney function can occur, often due to direct caused by chemo drugs like cisplatin. Long-term kidney disease can develop from repeated kidney injury, which may lead to a permanent decline in kidney function. Electrolyte imbalances are another sign where there is a disruption in the levels of key minerals like magnesium and potassium, contributing to weakness or heart issues, while some drugs weaken the kidney filters, allowing the protein to leak into the urine, which is a sign of worsening kidney damage. Who's most at risk? Patients who are already dehydrated or have a low fluid intake. Individuals taking other medications that stress the kidneys, such as painkillers and antibiotics, are also vulnerable. Patients with existing kidney disease or diabetes face a higher risk, as do older adults and those receiving high-dose chemotherapy. Preventing and managing damage from chemo-induced kidney damage involves taking extra fluids during chemo to help flush drugs from the kidneys and frequent blood tests to monitor kidney function and catch issues quickly. While chemo is vital for fighting cancer, protecting the kidneys requires teamwork between cancer doctors and kidney specialists. Mental health drugs are not void of adverse side effects. Here is why. 9. Lithium is a trusted medication for managing bipolar disorder, helping stabilize mood and reduce relapse risks. However, long-term use can harm the kidneys, requiring careful monitoring to balance its benefits with potential risks. How does lithium affect the kidneys? Over the years, lithium may gradually reduce kidney function, raising the risk of chronic kidney disease, CKD. While severe kidney failure is rare, even mild declines in filtering ability matter for patients needing lifelong treatment. Lithium can also cause nephrogenic diabetes insipidus, a condition where kidneys struggle to retain water, leading to frequent urination and thirst. This strains the kidneys and raises dehydration risks, especially if fluid intake isn't maintained. High lithium levels, often due to dehydration or overdose, can cause sudden kidney damage. Long-term use, even at safe doses, may slowly scar kidney tissue, worsening function over decades. Patients with bipolar disorder often face added kidney stressors like high blood pressure or diabetes, compounding lithium's effects. How can you manage risks caused by lithium? Regular blood tests to check lithium levels and kidney function every 3-6 months are crucial. Doctors aim to keep lithium doses as low as possible while maintaining effectiveness. For those with early signs of kidney trouble, alternatives like valproate might be considered, though they aren't always as effective. Staying hydrated and avoiding medications that strain the kidneys, for example NSAIDs, also helps protect kidney health. Let's consider yet another class of prescription with the potential to adversely affect the kidney, namely 10. Immunosuppressants like Cyclosporine and Tacrolimus are vital for preventing organ rejection in transplant patients. However, they can seriously harm kidney function, a risk that requires careful management. The short-term damage of immunosuppressants on the kidney comes shortly after starting treatment. These drugs may narrow the kidney's blood vessels, reducing their ability to filter waste. This can cause sudden drops in kidney function, high blood pressure, high potassium levels, or reduced urination. The risk increases with higher doses, so close monitoring is crucial. Long-term damage happens as a result of prolonged use, which can lead to irreversible scarring and damage in kidney tissues and blood vessels, often progressing to kidney failure. This damage can develop even without prior short-term issues. For example, up to 20% of liver transplant patients experience kidney failure within 5 years due to these medications. Kidney harm as a result of immunosuppressant drugs is seen as rising creatinine levels, a waste product in the blood, reduced kidney filtration and blood flow, and trouble regulating salts and acids. Further research is needed to better understand how kidney damage occurs and whether drugs like calcium channel blockers could help reduce harm. Your kidneys work hard every single day, filtering out toxins, balancing fluids, and keeping your body running smoothly. But as we've seen, certain medications can slowly wear them down if not used properly. From common painkillers to life-saving antibiotics, and even mental health drugs, the impact on kidney health can be serious, especially with long-term use or incorrect dosing. The good news? You have the power to protect your kidneys. Stay informed, follow your doctor's guidance, drink plenty of water, and get regular checkups if you're taking medications that could affect kidney function. Small changes, like choosing safer alternatives, adjusting dosages, or simply being mindful of your medication routine, can go a long way in keeping your kidneys healthy. Your health is your greatest treasure, so take care of it. If you found this video helpful, give it a thumbs up and share it with someone who might need to hear this. And don't forget to subscribe for more health tips that could save your life.